Pricing of healthcare services. Let's go back to the hospital. You've now understood your costs, you know what you spend, where the money goes. But then a patient walks in and asks, how much will this cost? And suddenly, everything depends on your answer. Because if the price is too high, the patient may leave. If the price is low, the hospital may suffer. That decision is called pricing. What is healthcare pricing? Healthcare pricing is the process of determining the monetary value charged for healthcare services, procedures, medications, and consultations. Healthcare pricing is not just about choosing a number, it is a deliberate process that involves analyzing the cost, understanding patient behavior, and considering the environment in which the hospital operates. Managers must strike a balance between financial stability and patient access. If pricing is not handled properly, the hospital may either lose patients or operate at a loss. Example, if treating a patient costs 50 Ghana cedis, charging exactly 50 Ghana cedis means no profit. Charging 80 Ghana cedis may bring profit but reduce demand. So pricing is about finding the right balance. Pricing decision. Pricing decision is the determination of rates and discounts to be applied to health services. Pricing decisions involve more than setting a fixed price. They include deciding when to adjust prices, when to give discount, and how to respond to changes in demand. Managers must constantly evaluate whether pricing strategies are still effective under changing conditions. Example, a company offers to bring many patients but asks for a discount. You must decide whether the increased volume compensates for the lower price. Now, what influences these decisions? Factors influencing pricing. 1. Cost of service. The cost of providing healthcare services is the foundation of pricing. If costs are not properly understood, pricing decisions will be inaccurate. Hospitals must consider both fixed and variable costs when setting prices. 2. Patient affordability. Patients must be able to pay for services. If prices are too high, they may avoid seeking care, which reduces demand and affects revenue. 3. Competition. Hospitals operate in a competitive environment. The presence of other healthcare providers influences pricing decisions. If competitors charge lower prices, patients may switch. 4. Government regulation. Government policies and insurance schemes such as the NHIS influence pricing by setting limits or controlling reimbursement rates. 5. Insurance reimbursements. Hospitals rely on payments from insurance schemes. Delays or low reimbursement rate can affect financial stability. Now let's understand the types of providers because not every hospital controls its prices. Types of providers. Price taker. A price taker is a healthcare provider that accepts price determined by external factors or external forces. These providers do not have control over pricing. They must accept prices set by systems such as NHIS. Example is public hospitals under NHIS. Price maker. A price maker is a provider that has the ability to set its own prices. These providers have flexibility in pricing but must remain competitive and consider patient affordability. Example, private hospitals. Now you understand something important. Pricing is not just about numbers, it is about strategy. Let's move to pricing strategies. Full cost pricing. Full cost pricing is setting prices to cover all costs, fixed, variable, and overhead costs. This ensures that the hospital does not operate at a loss. All costs are included when determining the price. However, this may result in higher prices, which could reduce patient demand. Target costing. Target costing is A pricing approach where market price is predetermined and cost must be adjusted to fit that price. Here, the hospital does not control the price and must find ways to reduce costs to remain viable. Competitive pricing. Competitive pricing is setting prices based on competitors' price. Hospitals monitor competitors and adjust their prices accordingly to remain attractive to patients. Value based pricing. Value based pricing is pricing based on the perceived value and quality of health services. Hospitals with higher quality services may charge higher prices due to better outcomes. Now, let's look at the importance of pricing. Pricing is essential because it determines how revenue the hospital generates. Without proper pricing, the hospital cannot sustain its operations. It ensures cost recovery, allowing the hospital to cover expenses. It also influences patients' access, as price affects whether patients can afford services. Finally, it supports financial sustainability, ensuring long-term survival. Challenges in pricing. Pricing in healthcare is challenging because hospitals must balance affordability with profitability. Delayed NHIS reimbursement creates financial pressure. High cost of medical supplies makes it difficult to maintain affordable prices. Competition may force hospitals to reduce prices, affecting profit margins. Let's look at a scenario. Patient numbers are low. What do? You may adjust pricing, offer discounts, improve service quality, or increase awareness. Let's look at another one. Costs are increasing. What do? You may review pricing strategy, improve efficiency, and then you reduce waste. This is Eric Podcast.